I know foremost in everyone's mind is a vaccine program, and let me begin with that. We've certainly heard from many people in the public who are angry or frustrated about the vaccine program. They don't feel that they understand how they can get a vaccine or perhaps even where to get a vaccine. I want you to know that we hear all of those people who are saying that and share a lot of their frustration as well. It's my responsibility to make sure that you get a vaccine, and I will do that. Our team will make sure that you get a vaccine if you want to get a vaccine in this state. We will do it as quickly as we possibly can. We are not going to have vaccine that's sitting in freezers or sitting on the shelf. In fact, it is not now. But we want to make that very clear to everyone that we are going to get vaccine out as quickly as possible and into people's arms. If you are a person who wants a vaccine in Alabama, you're going to get that. I want to let you know what we're doing to accelerate the pace of the rollout. People certainly have a right to expect that we could do things faster. I think we also can do things faster. And so we have several things that we're implementing to make sure that happens. Our county health departments who are doing vaccinations are under instructions now to do vaccines all day, every day until they run out. They are suspending some of their other clinical services to the extent they're allowed to do that to make sure staff is available, and they're vaccinating everyone all day, every day until they run out of their allotment. The only vaccine remaining in county health departments at this point are second doses for people, or in some cases, people that have appointments through the rest of the month to come in for their first dose. But there's no additional vaccine remaining at this time. They are giving it out as quickly as they can get it. We are surveying all the providers in the state again today, personally, individually, to ascertain just exactly what supply that they have remaining. All providers are already required to do this by federal rule to report to us and to report to the feds, but we know that many are not doing that. Some are having technical challenges about submitting that information, so we're contacting them individually to know exactly how much vaccine each person has, each provider has. If there are cases where people have vaccine that they're not giving and should be, we are going to redistribute that to someone else. In fact, we have already begun doing that this week. We moved some vaccine yesterday. I want to acknowledge that there are always going to be parts of our state, particularly our rural areas, where people just have access to care issues and transportation issues, and we understand they're not going to be able to give it quite as fast. We're not going to penalize those folks, of course. But for those who have some vaccine that they're not giving as quickly as they should, we're going to move that to another location. We are going to give each provider a week for each shipment that they receive, and they are expected to administer the majority of that, and if not, we'll make a determination about whether that vaccine needs to go somewhere else. As the governor mentioned, we do have our location map online. We update that daily as providers get vaccine. As providers run out of vaccine, they may not always have it available, but for anybody in their community, they can look at that map and determine just exactly who has vaccine in their area and where to go. We are very happy to announce that we reached a partnership with Walmart. Walmart Pharmacy will begin administering COVID vaccine as well. We have talked to them for some time, and we're awaiting the rollout of a federal program that was expected to bring in the chain pharmacies. We know that's going to happen at some point, but in the meantime, we've asked them to help with administration of our vaccine as well. The exact numbers are still being worked out, but we'll have say-so in public health about where in the state those doses go so that we can make sure we get them to those parts of the state that need them the most. And we look forward to working with them. We are in conversations with another large chain pharmacy as well that I hopefully will be able to speak about very soon. We have an online portal for people to make appointments for vaccination that will be rolling out just in the next few days. We've been working very hard to get that there. I know there's been a lot of frustration over the phone line. We actually have 165 phone lines that are being answered when people call that number, and yet it has been overwhelmed as most of those calls, more than 50% of those calls, are from people who are not eligible at this time to receive the vaccine. For people who do call, we will take your information. We'll get that information to a local county health department and keep up with that so that you can be notified when it is your time to get a vaccine. But again, I would encourage you, please don't call if you're not eligible currently at this time. It makes it more difficult for those who we're trying to reach right now. We continue to add providers who can give vaccine. As of this morning, we had 502 providers around the state, 502 locations that are fully enrolled and eligible to receive vaccine. Unfortunately, only a little over half of those have actually received vaccine at any point because we simply don't have enough to go around. But we expect that people can get vaccine when we have the adequate supply at wherever they get their normal medical care. We want them to go to their doctor or their clinic or urgent care or wherever their federally qualified health center, wherever they go for care is where we want people to get their vaccine, and we have those providers ready to go. I would say that I certainly understand the frustration on the people who look at other states and see giant vaccination clinics going on. I would say those are certainly a trade-off. Many of those sites have had their own problems as well, with people waiting in very long lines and traveling from hours away and sometimes sleeping in their cars or getting turned away when the vaccine runs out, and then having to do it all again when a second dose is due a couple of weeks later or a month later. So we certainly understand that the expectation of the public changes when they see these large groups, large clinics going on. We will certainly have those too when we have the ability to do that in a way that actually takes care of those people who need them. We don't have enough vaccine for really large-scale, long-term mass clinics, but we are doing drive-through clinics now. We've done them every day this week in a few counties. We're doing clinics one at a time as we have vaccine available in a number of counties, and we will continue to have those to make that more convenient for people.